This is Orchard Villa calling to provide an update. We understand you may have seen the media coverage this week regarding our long-term care community and that you are concerned about your loved ones.
As the pandemic entered its deadliest phase, robocalls were the only source of info from inside Orchard Villa.
We have asked for assistance from our local healthcare partners to address our staffing issues.
More people would die here than anywhere else in Ontario, but we can reveal the home was already among the most problematic before COVID hit. Dozens of warnings from government inspectors, year after year, violations repeated.
Well, good afternoon.
With COVID, Ontario's premier promised it would be different.
We're putting an iron ring of protection around our seniors, especially those in long-term care.
But more than a year earlier, the Ford government ended its most detailed surveillance of nursing homes called Resident Quality Inspections, or RQIs.
They are very detailed. They take a long time, they take a lot of staff, and they're expensive. Under this government, they've decided to look at complaints and critical incidents.
And that, says lawyer and elder advocate Jane Meadis, left care homes further weakened just before the pandemic.
Am I right in saying the government has moved from a system where they proactively looked to see if there were problems in a place to one that only responded after the problems happened?
That's correct.
And now, CBC News has learned the government's own documents from 2015 warned the since-cancelled inspections were up to 5 times more thorough than what's replaced them, and were much more likely to identify infection control problems. Their cancellation, critics warn, left homes unprepared for what happened next.
Once you got inside Orchard Villa, what concerns did you have?
Severe concern by the nursing staff.
What were they concerned about?
Not being prepared, and that something very ugly was coming.
Nurse Kathy Legier is an infection control expert. She volunteered to come out of retirement and was hired on at the home to help.
When you saw that some people were going to get sick in rooms where others weren't, what did you suggest and what did they do?
When COVID first dangled its toe in Orchard Villa, it was in a 4-bedroom. And so immediately my thought is, you've got to get that patient out.
But Kathy says management ignored her warnings.
So it didn't happen?
It didn't happen.
So
2 days later, the infectious person was still in with the other 3 who were now positive as well. No big surprise.
In the year before COVID, with detailed inspections eliminated, we can reveal infection control violations dropped dramatically by 68%.
We are seeing fewer violations that are being caught because the complaint inspections requires a resident or some other person to make a complaint. Is the home really going to tell on itself? They don't. And we see this over and over and over again. So there is nothing being done to proactively prevent homes from going down a bad path.
The government's new inspections are uncovering nearly a third fewer problems overall. And when problems aren't found, they can fester. So we're taking a detailed look inside Orchard Villa once COVID hit.
At the time when they called me, I could hear her like moaning and yelling in the background.
Bryce Russell got the call in the middle of the night. His mother Lorraine inside Orchard Villa had fallen.
They found her on the ground, pillow between her knees, head up against the bed.
She's injured, sent by ambulance to hospital.
The doctor was telling me that Mom was now malnourished. Her prognosis wasn't very good.
Why hadn't staff noticed? Under the more detailed inspection regime, the home had been told to shape up.
Okay. They've actually been cited, warned by the ministry 7 times over just 4 years. April 2016, resident not transferred to hospital after a fall until the next day. July 2015, family of a resident not notified of a fall with injury until about 7 hours after the decision was made to transfer that person to hospital.
Yeah, exactly. So they're obviously not equipped, not paying attention, or don't care.
He and Kathy Legier are among many families and staff now suing Orchard Villa over its actions and inactions. As the death toll climbs inside Orchard Villa, the military is called in and reports caregiver burnout amongst the overwhelmed staff. And at Orchard Villa, they'd had problems for years.
What can you tell me about the conditions at Orchard Villa before COVID?
Before COVID, staffing-wise, we're always short.
We're protecting the identity of this Orchard Villa staffer.
A typical shift we have in the morning, if you don't have enough staff, you have to call the supervisor to tell them you're short.
How often is that happening?
Often.
Really? Like
almost every day.
Almost every day you're short-staffed?
Yeah.
Why did it take the military going into these 5 homes to highlight these problems?
I know that there was a crisis. It took the military to be there 24/7. That's when you find out there's cracks in the system, by living the system around the clock every single day.
Should politicians be shocked by what they're seeing?
The politicians should not have been shocked. The premier should have known these things were happening.
Should have known, because Orchard Villa had been cited for 148 violations in 5 years.
The ministry inspectors found problems in 2015, grime in washrooms, cobwebs, dead bugs, dirty beds and seating. And then those same things, those same violations are repeated the next year and the year after that. Does it surprise you?
No, and those are harsh findings. But at the end of the day, if an infraction notice has no teeth, what's your motivation to change? If it's going to cost you money to change.
What about the motivation to save lives?
That should be forefront.
In a statement, Orchard Villa, run by Southbridge Care Homes, says they've hired a new dedicated recruiter to address staffing challenges, adding new expertise to strengthen infection prevention and control initiatives, but won't discuss specific experiences for the privacy of our residents.
Meanwhile, the province tells us every home is inspected at least once a year, though since the cancellation of those more detailed inspections, the frequency and intensity of reviews is now determined by risk. So something has to go wrong at a home before inspectors show up.
A lot went wrong at Orchard Villa, and Kathy tried to speak up, but says her advice was ignored.
Not having someone with your expertise in there, did that cost lives?
I think I could have significantly helped soften the blow. Sorry. And later at home watching it on the news, I just wanted to be there. I just wanted to be there and be helping. It's all I wanted to do. Yep.
Seeing problems, but helpless to change them, and the pandemic still looms, swelling cases threatening care homes once more. David Common, CBC News, Pickering, Ontario.